I'm happy to answer any questions afterwards too regarding some of this data and where it's headed and how far we've come with breast reconstruction. I mean, we've advanced tremendously over the last 5 years, actually over the last 2 years alone. So my name is again Gabriel. I'm a board certified plastic surgeon here in Portland, Oregon, where I perform breast reconstruction following mastectomy as a really big part of my practice. I'm testifying today on behalf of American Society of Plastic Surgeons and the 87 board certified plastic surgeons in our state. As a surgeon who performs a surgery in the state, I'm here to encourage the Oregon Health Plan to cover the use of ADM in breast reconstruction. These matrices have been used for 2 decades in post-mastectomy procedures and have become the standard of care. Various studies, some you already shared, have proven that the use of ADM has multiple benefits, including allowing for single-stage procedures for tissue expanders or implant-based breast reconstruction. It really does limit the inflammation in matrices themselves and changes the cause of capsular contracture and therefore decreasing the risk of long-term complications and especially decreasing the complications that's associated with radiation. While I acknowledge that the FDA has not approved the official use of the ADM in breast surgery, the FDA does permit off-label use of products. Moreover, the FDA even includes in its own guidance on human cell tissues and cellular and tissue-based products that are used to skin to cover for breast implant and actually provide support as a soft tissue in lieu of the lack of support that's associated following the mastectomy, and this really serves as a basic function of the dermis. There's further support of the use of ADM under both state and federal law. The Women's Health and Cancer Rights Act of 1998 mandates that the health insurance cover breast reconstruction, and actually the state of Oregon in 2017 did pass a law to further educate patients in the state about the reconstructive rights following breast cancer surgery. These are all positive steps really in women's health that we've had and have led to a large number of insurance companies complying with the law nationwide and covering breast reconstruction, including when the procedures are done with the ADM, which is roughly about 64%. I know 68 was mentioned, but it depends on the year, and it's right now around 74% of the time. Choosing not to cover these ADMs in breast reconstruction is a slippery slope because it could lead and set precedent for insurers to reconsider their own coverage policies. Therefore, not only would be limiting access to a procedure for Oregon Health Plan enrollees, but also potentially limiting access for other patients in our state. I know for a fact there are surgeons in our state who will no longer perform breast reconstruction for OHP enrollees because the plan will not cover the use of ADMs. My colleagues are unwilling at this point to provide substandard care by not using ADM, which in turn has limited the patient's access to skilled plastic surgeons. We should really encourage our patients to see providers who utilize the highest standard of care and really not to deter them. So I appreciate the unique position that the Oregon Health Authority is in regarding to ADM and breast reconstruction. You need extensive data to make decisions that affect the well-being of Oregonians. I believe American Society of Plastic Surgeons has provided you with extensive references in their letter that was attached that can help address the knowledge gap. As the use of ADMs has been the standard of care for now for 2 decades with extensive data to prove its efficacy, I urge the Value-Based Benefits Subcommittee and the Health Evidence Review Commission to really recommend that OHP cover the use of ADMs in breast surgery. Like I said in the beginning, we've come a long ways in breast reconstruction. We've gone from under muscle to dual plane, now over muscle, and it really has changed the life of our breast cancer patients, and we ask you to offer that to our Oregonians as well. And I'm happy to answer any questions from the subcommittee at this time. Thank you so much.